they have the resources. The Commission Corps, which I helped lead with Admiral Giroir,
Yeah.
is being deployed. National Guard. We're using everything to get these vaccines into arms. So not Pollyanna-ish. There's projections, there's reality, and then there's what we're doing to improve. We're going to work to improve with the states, and I commit to the American people that you've got 100% of my focus, my attention, and the Commission Corps' focus and attention to make this happen.
Unfortunately, we don't have 100% of the president's focus. He's focused on trying to undo the results of the election. And when he mentions COVID, he says things like what he just tweeted, another lie about coronavirus this morning. He tweeted, the number of cases and deaths of the China virus is far exaggerated in the United States because of the CDC's ridiculous method of determination compared to other countries, many of whom report purposely very inaccurately and low. When in doubt, call it COVID. Fake news. That is not true. The CDC does not have a guideline of when in doubt, call it COVID. That is not the case. And 350,000 Americans have died from coronavirus. Can you tell the American people, including the families and friends of those who have died from coronavirus, that that is the real death toll? And what is it like as the Surgeon General when the President of the United States spreads these lies about the pandemic?
Well, Jake, you and I have talked about this, and one of the most challenging things about this entire pandemic from all sides has been trying to get health information to the American people in the midst of the politics. And I don't speak for the president. I speak for the Office of the Surgeon General and the Public Health Service, and I'm focused on making sure people can get the information they need. Wear a mask, wash your hands, watch your distance.
Is the death toll real?
Get your vaccine when it becomes available.
Is the death toll real? 350,000 dead Americans. Is that real? Is that an actual number? Or does the CDC have a bogus way of when in doubt, call it COVID, as the president falsely claims?
From a public health perspective, I have no reason to doubt those numbers. And I think people need to be very aware that it's not just about the deaths, as we talked about earlier. It's about the hospitalizations, the capacity. These cases are having an impact in an array of ways. And people need to understand that there's a finish line in sight, but we've got to keep running towards it.
A new strain of coronavirus that's likely more contagious was first reported this week in Colorado. Now cases have been found in California, Florida. Is it safe to assume, do you assume that this new strain is already widespread across the U.S.?
Well, it's hard to say if it's widespread or not, but it is here. It's in many other countries. And the most important thing for people to know is that talking with our colleagues in the UK, talking with Tony Fauci, who I had a conversation with for a long time yesterday, we do not so far feel that this new strain or these new strains will be resistant to the vaccines or to the therapeutics that we have available. So that's good news. But if you feel that there's a strain out there that is more contagious, and it looks like these new strains may be more contagious, even if they're not more deadly, it means that it's even more important that we follow these basic public health measures and that we get people vaccinated as quickly as possible. So the bottom line is we have the tools, regardless of the strain, to be able to defeat this virus. We just need the will to actually follow through and do the things that we know will help us.